Oxygen as a service providers we work with in Nigeria, Uganda, Kenya, India, and Tanzania have improved oxygen availability, patient care, and cost predictability across a variety of settings. However, scaling these services is challenging, as they are operating in contexts where oxygen systems are complex and often fragmented. We are here to share some lessons we have learned from this group of businesses and to highlight how these services can be tailored for context and adapted for wider impact.
In smaller primary health facilities with very low oxygen demand, concentrators can work well, but as the size of the facility grows and demand increases, simply adding more concentrators isn't suitable. At some point, larger systems like PSA plants become necessary. Many facilities, however, fall somewhere in between. They need more oxygen than small concentrators can provide, but not enough to justify a full PSA plant. Others have demand close to PSA levels, but require third-party management to remain cost-effective. This is where offering a mix of equipment comes in. By providing a range of options tailored to each facility's needs, as well as regional demand across multiple facilities, an oxygen service provider can help develop a service model that is both financially sustainable and operationally effective.
With our oxygen as a service offering, we've been able to see that there are different needs for different archetype of facilities. When we wanted to start at our first-tier hospital, we realized that our production can match their demand. And by the time we look at the market survey, we see that there are a whole lot of facilities that are like this that we will be scaling to. So that actually showed us that it's not a one-off thing. It's something that we need to plan on, and that actually advise the need for us to mix our equipment offering, and it brings in the modular PSA plant so that we can up our production, and we can, like our mantra has been, sustainable supply for demand. We have 100% supply for every demand that our facilities need.
One of the facilities we focus on are remote facilities where oxygen access is rare. Getting goods from the national delivery system is quite hard, and it takes about 3 months. So what we do is we look for those facilities, like a facility in Bundibujo, where it's a PNFP, high volume, and it's usually a referral facility in case power is out in the district. So this facility has about 5 concentrators that are maintained by a private entity. And one of the reasons why we gave them the free O2 oxygen system is because we know it works with or without electricity, combining oxygen concentrators and oxygen cylinders. So this ensured that they can have their pediatric ward always having oxygen with or without power, and all the referrals coming from the government facilities are able to have oxygen at all times to ensure that these babies or the referred patients are managed effectively and are recover in time, because they're having sustainable oxygen. They have a free O2 oxygen system on top of many other, the generator and other concentrators that they use, so they're able to manage this high volume patient care and also the referrals that come in during emergencies.
When facilities can access the right oxygen solution for their needs, everyone benefits. The service provider, the facility, and most importantly, the patients.